Receiving a new medical diagnosis can be overwhelming, and it's normal to have questions and concerns. Sometimes it's hard to even know where to start or what to ask. Here are some questions you may want to have prepared to ask your healthcare provider when given a new diagnosis. What type of specialist do I need to see? Do you need a referral? How often do I need to see them? It'll be really nice if your doctor could refer you to a specialist that they are familiar with that sees patients with your diagnosis. Who will be on my care team? Will you need to have a number of different specialists? Will there be some sort of provider that will check in on you frequently? What are my treatment options and what have other patients done? If your provider explains what the typical treatment option is and that doesn't sound like it works for you, you can absolutely ask what the alternatives are and what other patients have done. This can be really helpful because not everyone realizes that they actually have options. What will my follow-up care look like? Will I need to go in and get blood testing or other types of testing? How often will these things be needed? What are we looking for? Etc. Is there research I can enroll in? Many times if you're seen at a major academic institution, they will have some sort of research or they'll know some place that researches your condition, especially if it's a rare disease. That can be really helpful to connect with others and to connect with the team of scientists anywhere in the world that is studying what you have. It's a way for you to learn more and become the expert in your own care. Are there therapists or mental health professionals that deal with this? A new diagnosis is tough, especially on top of other things you may have going on. Everyone at some point in their life will benefit from seeing a therapist or receiving mental health services. And when you get a diagnosis that's new for you and scary or causes anxiety, it's a good time to seek out mental health care just to give you an added boost in handling your own health. Are there support groups or patient advocacy groups for this condition? Many different conditions will have groups of people either regionally or nationally or internationally, whether they're virtual or in person, that provides you with an opportunity to meet others with the same condition, see what their care has looked like. And this can be so valuable because if you have some sort of rare condition or diagnosis that your doctor may not have as much experience with, many patients find that being part of one of these support groups or patient advocacy groups allows them to be as up to date as possible with any of the technology used or treatments, medications, surgeries, anything that has to do with their diagnosis. It allows you to become more confident, more aware, and more involved in your own care. It's important to be honest and open with your healthcare provider. Understanding your diagnosis and treatment options can help you make the most informed decisions about your healthcare and feel more in control of your own health.